Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the bone evaluation around implants. On the 3D rendering, the bone quality and the bone quantity does not seem to be very adequate. We'll start with the lower right implant. This is the distal most implant in the first molar region. As you can very clearly see, this implant is suffering from significant bone loss with absolutely no bone in the peri-implant area. So there is definite peri-implantitis on all aspects of around this implant. The implant on the lower right side premolar region has bone loss on the buccal aspect, approximately 5 millimeters. But other than that, it has good bone support on the other sides of the implant. Now moving on to the implants on the lower left hand side, this is the premolar implant. Again, significant peri-implant bone loss. We only have bone support in the apical 1/3. This is the implant in the first molar region. Again, very significant bone loss on the buccal aspect with slightly better bone support on the lingual aspect. We have approximately from the neck here down 5.8 millimeters of bone loss on the buccal aspect and only 3 millimeters of bone available with bone support on the apical side. This is the implant on the second molar region. This implant again has slightly better bone levels, as you can very clearly see on buccal and the lingual aspect. Does not have as significant bone loss as the rest of these implants. Now the axial view is also going to show you something very nice, and that is here you can very clearly see there no bone around this implant, no bone around the right two implants, no bone around the anterior implant on the left side, slight bone in the lingual of the first molar implant of the left side, and good bone on the all around on the 7 of the left side. As we move further down, you'll see that there some semblance of bone is coming around most implants, whereas the ones which are failing have zero bone support. Thank you very much.